I just want to educate people what physical therapy is, and actually what physical therapy is not supposed to be. So if you've ever been to a physical therapy office before and you've got like heat and electrical stimulation and you were given some handouts to do at home, that's really not what we do. That is a very, very watered down version of what we do. I would say if we're use a car comparison, that would be the beat up Pinto versus versus a Ferrari. I mean, this is, you know, apples and oranges at this point. What should be done, what you should expect from a physical therapy office is that you are evaluated very specifically. And when I say evaluated, every session should almost be its own evaluation. The body is very complex. You might have a shoulder problem, but there might be some relation in the opposite hip. There might be a foot problem that is not letting the changes that you're trying to make in the shoulder actually hold. Sometimes it acts like a shoulder problem, but it's actually a neck problem. There's a lot of complexity when it comes to orthopedic and sports dysfunctions, and it needs to be constantly evaluated. So being seen by maybe a physical therapy aide who is kind of going over some exercise with you, or just being given some handouts, it's very hard to get the results that you're looking for when you're being given something that was maybe seen in the first session, in that first evaluation, but a lot of things could have been missed between that session and where you are now. So when you do go to an outpatient office, just make sure that you're being seen by a licensed clinician, someone who has experience, who's been doing this, who understands what an exercise is supposed to do, what a corrective exercise is supposed to accomplish, and not just about, here you go, do this exercise, it didn't work, okay, all right, go back to your doctor and let's get you in for surgery or something like that. So, you know, before you even make that determination, if you're about to get surgery, you need to make sure that all real options have been exhausted. All real conservative treatment options have been exhausted. I've seen too many people who've had surgery where they really shouldn't have, and they've tried physical therapy, again, maybe some heat and stimulation, and you know, maybe a little bit of hands-on work, maybe a few exercises as they were walking out the door, but that's not really what it's meant to be. So if you've had that situation and you're contemplating, you're hopeless, you don't know what to do at this point, it would be worth it to try somewhere where you're going to get that Ferrari, and you want to get that upgrade, because that could be the difference between you having metal implanted in your body or something cut out of your body in a surgery procedure or not. It could be the difference between you actually getting better in the long run or not. So if you have any questions, feel free to email us at info@jamsportsandspine.com. We're happy to answer all your questions. If we can help you, we'll help you. If we can't, we'll let you know as well.